This medication is for treating or preventing high pressure inside the eye that may occur during and after laser eye surgery. By reducing high pressure inside the eye, it can help prevent decreased vision or blindness in the eye treated by laser surgery. Apraclonidine works by decreasing the amount of fluid within the eye. It is important to use this medication as directed by your doctor. The recommended dosage is usually 1 drop in the affected eyes 3 times daily, starting 1 hour before the surgery and continuing for up to 21 days after the surgery. It is best to use this medication at evenly spaced intervals throughout the day. This medication is administered as an eye drop, usually by a healthcare professional. It should not be taken orally or injected into the eye. For laser eye surgery, it is typically given 1 hour before the procedure and again at the end of treatment. To apply the eye drops, wash your hands first. To prevent contamination, be careful not to touch the dropper tip or let it touch your eye or any surface. Tilt your head back, look up, and pull down the lower eyelid to create a pocket. Hold the dropper directly over your eye and place 1 drop into the pocket. Release the eyelid and gently close your eyes. Place 1 finger at the corner of your eye, near the nose, and apply gentle pressure for 1 to 2 minutes to prevent the medication from draining out. Try not to blink and refrain from rubbing your eye. Wipe away any excess solution around the eye with a tissue and wash your hands to remove any medicine that may be on them. If you are using another type of eye medication, such as drops or ointments, wait at least 5 minutes before using the other medication. Use eye drops before ointments to allow the eye drops to enter the eye. Some common side effects of using Iopidine Dropperette, single-use dropper include eye discomfort, redness, burning, blurred vision, upset stomach, dizziness, or drowsiness. If you experience itching, watering, or swelling of the eyelids, it could be a sign of an allergic reaction. It's important to let your doctor or pharmacist know if any of these effects persist or worsen. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience fainting, mood changes, or a slow/irregular heartbeat. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. As for the optimal timing and dosage of this medication, it's best to follow your doctor's instructions. They will determine the proper dosage and frequency for your specific condition. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. Before using Iopidine Dropperette, single-use dropper, it's important to inform your doctor or pharmacist about any allergies you have, including allergies to apraclonidine or clonidine. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of blood vessel disease, high blood pressure, heart problems, kidney disease, mental/mood disorders, or fainting after emotional stress. After applying this medication, you may experience temporary blurred or unstable vision. It can also rarely make you feel dizzy or drowsy. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is also unknown if this medication passes into breast milk, so consulting your doctor before breastfeeding is recommended. When using Iopidine Dropperette, single-use dropper, it's important to be aware of potential drug interactions. It's crucial to inform your doctor and pharmacist of all the medications and products you are currently using to avoid any negative interactions. This includes both prescription and non-prescription drugs, as well as herbal products. Avoid taking MAO inhibitors while using this medication, as it can lead to serious and possibly fatal interactions. It's important to discuss with your doctor when to start or stop taking MAO inhibitors in relation to your treatment with Iopidine Dropperette. Additionally, be cautious if you are taking other products that may cause drowsiness, such as alcohol, marijuana, antihistamines, sleep or anxiety medications, muscle relaxants, and opioid pain relievers. Always check the labels on your medicines, including over-the-counter products, as they may also contain ingredients that cause drowsiness. If you have any concerns, it's best to consult with your pharmacist to ensure the safe use of these products. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include a slow heartbeat, drowsiness, and cold/clammy skin. Always seek professional help in case of an overdose. Remember, it is important to use this medication as directed by your doctor and to follow their instructions carefully to avoid any potential risks. You should not share this medication with others. Your doctor may perform lab and/or medical tests, such as pulse, blood pressure, eye exams, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. In today's video, we will be discussing the Iopidine Dropperette, single-use dropper. This medication is used to lower increased pressure in the eye due to a specific type of glaucoma. It works by decreasing the amount of fluid in the eye. It is important to use this medication exactly as prescribed by your doctor. Typically, 1 drop of the solution is used in the affected eyes 3 times a day, with the doses spaced about 8 hours apart. It is best to use this medication at the same times each day. This can help to keep the amount of medication in your body at a consistent level. Be sure to follow your doctor's instructions carefully. If you have any questions or concerns about using Iopidine Dropperette, single-use dropper, be sure to discuss them with your healthcare provider. When you have Iopidine Dropperette, single-use dropper at home, it's important to store it properly. You can keep it in the refrigerator or at room temperature, but make sure it's away from light and don't freeze it. And as with any medication, always keep it out of reach of children and pets. When it comes to disposing of the product, don't flush it down the toilet or pour it into a drain unless specifically told to do so. Instead, when it's expired or you no longer need it, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.